Good evening, everyone. My name is Dr. Deborah Duro. I'm a Program Director of Pediatric Gastroenterology, Pathology and Nutrition at Broward Health in Fort Lauderdale, and the current Chair of the Nutrition Committee at NASPGHAN. I am thrilled to welcome you to the third webinar in our exciting new culinary medicine series, Eosinophilic Esophagitis. I am happy to serve you as a moderator this evening, along with Vanessa Weisbrod. Vanessa is the Chief Education and Community Engagement Officer for the Celiac Disease Foundation. She's also a medical chef and will be presenting this evening along with Dr. Erin Siverson and Crystal Tsai. Dr. Siverson is a gastroenterologist at Boston Children and director of their Eosinophilic GI disease program. She has a passion for advocacy and caring for children with EOE and other eosinophilic GI diseases and GI allergies. Crystal Tsai is a clinical dietitian at Palo Alto Foundation. She has worked with pediatric patients and their families for most of her career and enjoys helping patients, making sure that they will still enjoy lives while following medical diet restrictions. Each webinar series is divided in 3 segments, with a physician educator discussing the topic, followed by a registered dietitian presenting relevant nutritional points related to some diets, and finally, a medical chef demonstrating some nice, easy, and fun recipes. I would like to thank now NASPGHAN and NASPGHAN Foundation for hosting this webinar, and in addition, a very special thank to Kate Farms, who supported this webinar series through an educational grant. We will take your questions at the end of the webinar, but please do not wait until the end to submit them. You may submit your questions at any time during the webinar in the box located directly beneath the webinar player window. Simply scroll down below and you'll see the submission box for the question. Without further ado, we are excited to begin. Please, Dr. Siverson, the floor is yours.
All right, thanks very much, guys. I'm very happy to be here with you this evening. So let's get started. I have no financial relevant conflicts to disclose. And I'd like to review what we're going to be discussing this evening. So from my perspective, we're going to be talking a little bit about the medical background of eosinophilic esophagitis, or EOE, reviewing what it is, the symptoms we see patients present with, and how we monitor it. And then I'm going to be introducing us to dietary management for EOE, important considerations that we think about when we're starting dietary elimination therapy, the types of ways that we approach this, and the different type of elimination diets that there are available for EOE treatment. So first, to talk about EOE clinical presentation and diagnosis. So what is EOE? Anyway, so EOE is a chronic condition that affects the esophagus, the tube connecting the mouth to the stomach. We know that chronic exposure to one or more food triggers causes the buildup of inflammation in the esophagus. This is caused by allergy cells known as eosinophils. This allergic response is different from what you might imagine when people have an IgE-mediated or anaphylactic allergy, when the reaction is immediate and might require an EpiPen or an emergency medical attention. The allergy in EOE is different. It's chronic, it can be subtle, and it builds up over time. It's kind of similar to eczema, where repeated exposure to a trigger causes the skin to get irritated, swollen, and scarred over time. This is similar to what actually happens in the esophagus and EOE when it's exposed to trigger foods over and over. The symptoms associated with EOE can vary a lot depending on a person's age. In infants and toddlers, we tend to see feeding difficulties, vomiting or regurgitation of foods, and poor weight gain. As kids get older, we start to hear more about abdominal pain and heartburn. And as they approach their teenage years, this is when we start to hear more about what's considered to be a classic sign of EOE, like trouble swallowing or food getting stuck in the esophagus. Because EOE can be hard to pick up in kids because they've developed ways of managing their symptoms, many families almost don't realize some of the symptoms initially. For these kids, we might hear about them taking a long time to eat, drinking a lot of water, using a lot of sauces during meals to help to get the food down, or having certain food or texture preferences. And sometimes kids get labeled as being picky eaters or having a limited diet without clear reasons why. Outside of these symptoms, why is it important to treat EOE? I think it can be obvious when a child's complaining of a lot of symptoms, but really what's going on inside and why does this matter? We know that over time that if EOE is left untreated, the inflammation caused by the allergy cells in the esophagus can turn into scarring. Scarring can cause the esophagus to get narrowed and tight, and it can make it more difficult for foods to pass. This scarring is also more difficult to treat with diet or medications, and sometimes actually requires upper endoscopies or scopes where the esophagus needs to be stretched or dilated to fix the problem. So for a number of reasons, it's really important for us to have a good approach to treat EOE. Now to pivot a bit to the dietary management of EOE. When we're thinking about treating EOE, we have three main goals. Most importantly, I want to help relieve a child's symptoms related to their EOE. In some cases, those symptoms don't always predict how well we're doing with treating the inflammation in the esophagus. And for that reason, we often need to repeat an upper endoscopy, or sometimes referred to as an EGD, after starting treatment to make sure that we're on track. When we repeat the EGD, we're looking for two things. We want to see, does the esophagus look better by just looking on the camera? And two, has the number of eosinophils, or those allergy cells, decreased when we look at biopsies of the tissue from the esophagus under the microscope? So all three of these things are important when we're monitoring to see how a child is responding to their EOE treatment. There's two main approaches that we use when treating EOE. We can either use medications or we can use dietary elimination. The focus of our talk today is going to be on dietary elimination, so that's what I'm going to be focusing on here. So what does that mean exactly? For the treatment of EOE, we recommend families eliminate one or more food groups from the child's diet in order to treat EOE, with the goal of if we can figure out what the trigger food is and we remove it, the EOE resolves and you can move on without symptoms. In order for this to be effective, it needs to be strict elimination, meaning reading labels on foods to make sure there's no hidden ingredients and trying our best to avoid any cheats or wavering from what we're supposed to be avoiding. So there's really many important things to consider for dietary elimination. This might not be the right approach for all children and their families, given many different factors. There's a lot of things that we'll think about, namely, is there anything that the child is already avoiding in their diet? Do they have other types of food allergies? Do they have other conditions that mean that they need to already avoid certain foods in the diet? Are they baseline quite limited eaters with a narrow palate? Are there other underlying eating disorders that we need to take into account? Those are all medical things I take into account to start. Then we look at other things. How's the child growing? What does weight gain look like? Are there concerns there that we need to take into account? And we have to think about how limiting diet further might affect that. How might this affect a child's quality of life? This is a really important consideration, regardless of the child's age. I think it's also very important to think about what other treatments have been tried already, to know what our likelihood of success is here. One additional thing is thinking of how are things going to move forward once we take a food out of the diet? How are we monitoring? What might this mean in terms of repeated upper endoscopies to take a look and see how our dietary interventions are working? Another thing that we think about is access to healthy dietary alternatives. Some diets, finding alternative sources of, say, dairy or wheat, for instance, they can be expensive, and depending on financial resources or where a family lives and what kind of grocery stores they even have in their local community, that can really affect things. And then are all family members on board? It's great if the family is, but you need to make sure that everyone is on the same page about how they're going to do this, because it's very important for everyone to be in agreement with this plan. One thing that I do like to remind families when we're thinking about this plan is that you're never stuck with what you decided to do for treatment for EOE. We might find that depending on the age of a child or the situation that a family has at a certain time, that they do well with dietary elimination at one age, and then they might want to pivot and try medication at another time, or vice versa. So it's important to think about all of these approaches and what might be the right time for a child. So it can be very helpful to have a team who can help to provide education and support. Many hospitals around the United States have multidisciplinary clinics for children with EOE that might be made up of one or more of these team members that can help to be supportive for families as they start down this treatment path. So once we decide on dietary elimination as how we want to treat a patient's EOE, how do we decide what to eliminate? We've learned a lot over the past few decades regarding EOE treatment. And unfortunately, we have found that allergy testing that's commonly used by allergists to identify anaphylactic or those immediate IgE-mediated allergies is not as useful in identifying EOE triggers. So that blood test or skin prick test that an allergist might use is less helpful in guiding us in determining EOE triggers. Some people may still use this data to guide their decision, but more commonly now what is being used is our knowledge of what we know to be the most common EOE triggers in combination with a discussion with family about what to choose to eliminate. So this chart shows some of the most common approaches for dietary elimination for EOE. Many physicians use either this or some variation on this when making a treatment plan for their patients with EOE. This ranges from the elimination of just one food group, which is least restrictive, all the way up to the restriction of all foods and only using a hypoallergenic formula, which is clearly the most restrictive. Each approach has different levels of effectiveness or chances of success for each patient. So in the one food elimination diet, only dairy is restricted. This is because we know that dairy is the most common food trigger in EOE. When we restrict dairy, we're restricting all foods that contain milk-based ingredients. So this is not just lactose, but includes milk proteins called casein and whey. While this is listed as the least restrictive, it's still a lot of work and can be difficult for families to implement. So it's no small matter. The 4-food and the 6-food elimination diets are increasingly restrictive and remove additional known EOE triggers. An elemental diet, as I briefly mentioned before, it's not commonly used, but I wanted to make sure I mentioned it. This is when all foods are restricted from the diet and the child is given a hypoallergenic or what's called an elemental formula as a replacement for foods. By eliminating all foods from the diet, it can be very effective in treating EOE, as you would imagine, but also can be very difficult to be compliant with long term. There are two schools of thought for approaching dietary elimination. You can either start with eliminating just 1 or 2 foods and eliminate more if needed, or you can eliminate all top 6 food groups to start with and then add foods back in. In the step-up approach, which you'll see illustrated here on the left, a scope or an EGD is repeated after having 1 or 2 foods out of the diet. And if EOE is still active, additional foods can be eliminated until the EOE is under control. In the top-down approach over here, top 6 food groups are eliminated to start with, and then a scope is done to ensure that the EOE has improved. And then one by one, food groups are added back into the diet, and a scope is repeated after 1 or 2 of those to make sure that the EOE is still under good control until we figure out what the trigger is. There's lots of variations on these approaches, and there's pros and cons of both approaches. So this is where it's really important to have a discussion with your medical team to help guide you at what will be the best approach for your child and your family. So to review what we've covered so far, I think it's very important to remember that EOE is a chronic condition that causes inflammation in the esophagus. It's caused by recurrent exposure to 1 or more foods in the diet. And EOE can be effectively treated with dietary elimination. It's important to think about a number of factors when starting a dietary elimination plan. We need to think about a lot of risks and benefits for both the child and their family. And there's lots of different approaches. And then I also included here a little bit of information, or a resource that I think is a very nice one for families to have on the NASPGHAN website, where you can learn more about EOE. Thanks very much, and I'm going to pass this on to my my dietitian colleague, who's going to pick up the rest of our discussion for this evening.
Okay, so thank you for the introduction, and I will be going over the nutrition management side of elimination diets for EOE. I have no financial disclosures to disclose. And hopefully by the end of this, we will all be able to identify the nutrients of concern to be mindful of while we have patients who are on an elimination diet for EOE, as well as be able to understand the sources of cross-contamination and ways that we can support patients and help them navigate various food situations, and reduce the risk of cross-contamination in their daily lives. So as we know, there's various ways to do the elimination diets with varying levels of restriction. The most restrictive would be to eliminate all of these that we see on the screen now, including milk, wheat, eggs, soy, fish, shellfish, nuts, and peanuts. And that's mainly what a lot of this will apply to, because that is the most restrictive. It will get a little bit easier if they eliminate less foods, but mainly it'll be sort of directed at as if they were eliminating all 6 of these. So when I'm getting to know a patient, I want to know if they have other food allergies or dietary restrictions that would make an elimination diet even more difficult to conduct, as well as if there is any more selective eating or food preferences that are sort of restrictive, that again would put them at higher risk of being deficient in any nutrients or having a poor quality of life if once they eliminate even more foods. And it's doesn't always necessarily mean that they're not a good fit for an elimination diet, but we do want to know where they're starting and what we need to be extra mindful of now that they're going to eliminate even more foods. I also usually want to know about their social support and emotional support at home, because this diet can be very difficult navigating social situations. I kind of want to know, do they have summer camp coming up, or a huge volleyball tournament or a week-long trip? Are they traveling somewhere soon? As well as whether the family tends to cook at home more, or if they're eating out a lot. And just kind of, their baseline, what we're starting with and what we might need to pay extra attention to when we're tweaking their normal habits to accommodate for an elimination diet in the family. And of course, we want to evaluate their lab values to see if there are already any nutrient deficiencies already, so that we can help make up for those and replenish any vitamins or minerals that need replenishing. We also want to look at their growth pattern and see if there's any catch-up that needs to be done, such as any catch-up weight gain while they're on the diet, or if they've already, always struggled with weight. That's something else we want to pay attention to, since that can add another layer to the elimination diet. So for many families, hearing that they have to eliminate all these foods is overwhelming. And so it can feel very daunting. And so I always like to focus on what they can eat and emphasize that variety is very important. And variety is the key to them making sure that they are able to get all the nutrients that they need, and so that they don't get bored of what they're eating. I always emphasize that there's still a lot of fruits and vegetables and protein sources that they can still have. And then there's lots of starches that they can have too, even with the elimination of wheat. And so I always want to just make sure families feel comfortable and more optimistic, because while it is very restrictive, especially if they are eliminating all 6 food groups, it is possible, and it is possible to still get all the nutrients they need and figure out a way to make it work. When we're looking at packaged foods, if I always tell families, if there is a label, definitely you should read it, and they should always check the ingredients list. Somewhat luckily, unfortunately, the FDA does actually mandate labeling of the top allergens, which just so happen to be all 6 foods that we are eliminating on the elimination diet for EOE. And so the labeling has to be very clear. Even if it's a hidden ingredient, there still needs to be clear labeling that it is in the food package. So for example, it has to contain this contain statement after the ingredients list. So if something, had a secret ingredient like semolina, for example, where some people don't know that that is actually wheat, in this contain statement, they would find a clear label of it contains wheat. Like, it's not going to say contains semolina anymore. It will say very clearly that it has wheat. The other way that it could be labeled if it does not have this contain statement is that the FDA does allow them to put it in parentheses in this ingredients list. So if the first ingredient was semolina, in parentheses next to it, it has to say wheat. And that makes it clear so that there's nothing hidden in there. And because the 6 food groups that we are eliminating are all mandated to be labeled, that is something that is slightly easier to look for when we are food shopping. There are also some brands of snacks and other foods that market themselves as allergy free, and they are free of all of the top allergens. And so those could be a good snack option or packaged food, convenient foods to look out for our kiddos that need food on the go, and when it's not as easy to make a full meal at home. Okay, so some nutrients of concern that we want to pay attention to while kids are on the elimination diet. One would be protein. This is not as big of a deal if the kids are still eating meat, because that will be the main source of protein when it comes to their meals. However, it can become more difficult if a patient is vegetarian, because they've essentially now become vegan with the 6 food elimination diet. And so their main protein sources will become lentils, beans, except for soybeans, and pea protein to help supplement their protein intake. Another one would be calcium and vitamin D. So because they're most likely going to have to eliminate dairy, which includes the whey and casein, since that is the protein aspect of the dairy that they need to eliminate, they will need to rely on calcium fortified plant-based milks, which includes pea milk, rice milk, gluten-free oat milk, hemp or coconut milk. I often also will have these kiddos just take a separate calcium and vitamin D supplement, especially in the case of them not really liking these plant-based milks or liking milk-like drinks in general. Then a supplement really is going to be the thing that will help get them where all the nutrients that they need. Another one is omega-3 fatty acids if they're eliminating fish, and if fish was a primary source of omega-3 fatty acids before, then they'll need to now rely on chia seeds and flaxseed, as well as canola oil. They can also choose to take an algae oil supplement, which will get them the omega-3s. Iodine is another one to be mindful of. So iodine is normally in dairy and fish and seafood. There is some iodine in our fruits and veggies because of iodine from the soil. However, it's very hard to measure how much iodine is actually in the fruit or vegetable. And so the best way, if they are on this elimination diet, I usually recommend using iodized salt to season food. They can also supplement with some seaweed like kombu, wakame, and nori. When we're thinking about recipes for the families, this is actually a good resource. It's for kids with food allergies, and so they can actually filter through which recipes are more useful for them, depending on how many foods they have to eliminate. There's also allergy-free cookbooks out there that folks can buy. And I always like to mention to parents too that they should go through and think about the nutrients that I just mentioned and consider what needs to be replaced or added on the side of that meal. Another way we can help support patients would be to actually make a Pinterest board for any recipes that we know of that are allergy-free or suitable for the 6-food elimination diet, and share that Pinterest board with them so that they have kind of more of a one-stop shop instead of having to browse the internet. I also go through what they eat at home normally, like their most commonly cooked meals, and start going through some ingredients that might need to be replaced. Often the whole family is not always going to do the 6-food elimination with them. And so we might have to take some of the ingredients out and make either 2 batches, one that is EOE friendly and one that's just the regular for everyone else. But it kind of depends on what each family is going to do and how we might adapt and tweak what they're normally doing so that they can meet the needs of the kiddo that's on the EOE diet. One thing that comes up is their growth. So because with any restrictive diet, it becomes limiting in what they can eat, and some kids will eat less. And so we don't want them to lose weight and for this to affect their growth. And so we sometimes do still need to mention high calorie foods that are still available to them just to make sure they are eating enough. So they can still use all the plant-based oils. They can use avocado, as well as sunflower seed butter and pumpkin seed butter, which I have seen now too, because those do not have any of the 6-food food ingredients that we are eliminating. If needed, we can also supplement with elemental formula, which also will actually not only help with providing calories, but also will provide some micronutrients. The one thing is we do know that elemental formula does not taste very good. And so we do want to try to increase the palatability of the elemental formula. So one thing I recommend is at the very minimum, you should drink it chilled, put ice in it, or maybe even blend it with ice to make it more of a slushy. And sometimes that can make it easier to drink. Another way would be to turn it into more of a smoothie with fruit or pumpkin pie spice, and keep it, EOE friendly, but without necessarily having to drink it as is. And some of the formula companies actually provide some recipes on their website. So when we're thinking about cross-contamination, there are unfortunately a lot of sources of cross-contamination. And so we do want to be careful. So at home, with any pots and pans, shared utensils, plates and bowls, as well as cutting boards, we do want to wash them thoroughly with soap and water to make sure that there's no leftover crumbs or anything that is not EOE friendly on those utensils and plates and bowls. The toaster is a little bit difficult because toasters are very hard to clean. We basically have to disassemble the whole thing, which is unrealistic to do every single time. So if families have a toaster oven, I usually recommend using that since that is a lot easier to clean for any wheat-free bread or EOE-friendly bread or bread-like products that need to go in the toaster or toasting oven. But we can't have them put like a wheat-free bread into a regular toaster that already has toasted normal bread, because unfortunately the crumbs in there will cross-contaminate the EOE-friendly food. When it comes to buffet restaurants, as well as social gatherings that have buffets, if it's a self-serve type of situation, it tends to be a higher risk for cross-contamination. Just because, one person might be scooping some mac and cheese and then put that same spoon into the fruit salad, which now is cross-contaminated with some cheese. And now our kiddo can't eat that. So we want to try to avoid those. If they can find somewhere where someone is actually doing the serving and it's, a little less risky for the cross-contamination, that could be okay. Or if it's a social gathering, I often recommend to parents maybe call the host ahead of time and see if they can set aside a plate for our patient to eat when they arrive. Or if they are just, if we arrive early and put aside a plate ourselves, that could work as well. Bulk bins in grocery stores, I love them, but unfortunately they're super high risk for cross-contamination. And so I do recommend temporarily at least purchasing prepackaged, beans and lentils or nuts if they're not eliminating nuts, anything like that instead of out of the bulk bin, because that is same problem, has a high risk of cross-contamination. And then restaurants, there's always a risk. So obviously the best way to avoid that cross-contamination would be to cook at home. However, I know that's not always realistic for our patients. And sometimes, they do need to eat out or get takeout, and there's always a risk. So calling ahead, browsing the menu, and using their best judgment is really going to be the best way to go. So if there is a place that maybe doesn't have the most hygienic practices, I would say probably pass on that one. But if there's a menu that already is almost there and they just want to take one ingredient out, and the kitchen says that they're going to be able to accommodate it, and it seems like they're flexible and able and willing to do that, to make these adjustments, that could be a little bit safer. But like I said, the best way to avoid the cross-contamination would be to cook at home when possible. So for social situations, there can be several different things that come up. So for kids have to go to school and sometimes they have to go to camp or day camps. And so for these, I recommend packing lunches and snacks from home, just so we can be sure that it's free of the foods that they need to avoid. If it's only 1 or 2 foods that they're eliminating, it could be easier to do school lunch or eat food from camp if they have some good options. But likely they'll still need to avoid milk and milk products. So either way, if the school can provide a menu ahead of time or camp can provide a menu ahead of time, looking ahead at the menu to see what needs to be maybe supplemented on the side would be helpful. And then again, the best way would just be to pack food from home. For birthday parties, sleepovers, gatherings, family barbecues, all of these things are going to come up, and we still want our patients to be able to enjoy hanging out and having a social life. So one of my favorite options is to have the family bring something that is EOE friendly and that could be shared. So that way we at least have 1 or 2 dishes that we know our patient can consume and enjoy with everyone else. If needed, eat something beforehand so that they aren't going super hungry. And then maybe they can find what's available there that is okay for them to eat. Packing some snacks is also a good idea, just so if they do get hungry and there's no more food that they're able to eat, we've at least brought our own. Replacing the birthday cake, for example, at a birthday party with a suitable treat is also something I usually recommend. So if it's a birthday party and there's going to be ice cream and cake and we know our kid can't have it, I usually recommend packing, fruit popsicle, or if you can find a vegan, gluten-free and soy-free cupcake, that could also be an option, so that our patient can enjoy the treats with everyone else and they don't feel like they're missing out. And then same thing for holidays. I would, prepare some food that our patient can have and replace any treats with a suitable one for the holiday. And this applies to like cupcakes and treats at school as well. I often recommend, if possible, for the parents to pack a suitable treat to enjoy when everyone else is having a cupcake with their friends at school. But if they don't know ahead of time, maybe bring it home and then they can trade with their parents for something that's a little bit more suitable. And that's all I have for today. And thank you so much. It was an honor to join this webinar.
Thank you both, Dr. Silverson and Crystal, for your great presentation. And now I would like to call our medical chef, Vanessa, to cook 2 recipes for us. Thank you, Vanessa.
Welcome to our kitchen. We're excited to talk about recipes that go very well with families that are dealing with eosinophilic esophagitis. We're getting close to the holidays, and one of the things we think about as we get towards the holidays are things like breakfast with your family, parties at your in-laws' houses, at grandma and grandpa's houses, and with your cousins. we also think about times when our kids are off of school and how we can include our kids in the cooking process. And so I have some helpers along with me today. For our first recipe, we have Brandon. How old are you?
I'm 10 years old.
And do you like to cook?
No, I don't like to cook. I love to cook.
And so, as you can see, he loves being in the kitchen and loves being a part of the recipes that we make for our family meals. So today we're going to demo 2 very simple recipes that any kid could make with or without the help of mom or dad. For our eosinophilic esophagitis recipes, we're going to be making a lemon mint berry salad and a sweet potato white bean hummus, both of which are absolutely delicious and really play on the flavors of fresh herbs. Our first recipe is going to use fresh mint and the second is going to use basil, and they're both going to taste absolutely amazing. The idea with the fruit salad is that oftentimes when families are following a very restricted diet, like for EOE, where they're eliminating things like dairy, wheat, soy, nuts, and seafood, among many other things potentially, food can get really boring. You're used to getting served things like plain chicken, a plain baked potato, and things aren't exciting. And so today we're going to take some very simple recipes and spice them up a little bit so you feel really special around your family's holiday table. So we're going to make a spiced up fruit salad, and we're going to spice it up with lemon, honey, and what's this herb, Brandon?
Mint.
That's right, mint. All right, so we're going to start with our fresh fruit. So this is some fresh blackberries that we have. Could you go ahead and add those to the bowl? And then some strawberries and blueberries. Good job. Now we're going to make our very simple dressing. Here we have just a tablespoon of orange blossom honey.
Yes.
And we're going to add some fresh squeezed lemon juice to it. Normally I would let Brandon do this step, but as you can see, he had a little soccer accident, and so we're down to only one hand right now. But normally this would be a Brandon job to squeeze the lemon juice. It's a really fun job for kids. They can squeeze it as hard as they like and get all of that juice out. All right, do you think you can whisk it together?
Sure.
All right, I'll hold the bowl for you. Go ahead and whisk it up. So now he's just mixing together the honey and the lemon juice to make our fruit salad dressing. Good job. All right, now you can pour that over the fruit. Oh, you know, we'll just get a little bit more off the bottom.
Okay.
All right, go ahead and pour that over the fruit. This is going to brighten up the taste of the fruit so much. You often think you just want those fresh fruit flavors, but just a little lemon juice and a little bit of honey and a little bit of mint can go a long way to making it taste just so much better. So for the mint, we're gonna stack it on top of each other, and we're gonna chiffonade it, which is a really fancy way of saying making pretty thin slices that are rolled up. So that's probably enough. I'm gonna roll up the mint. Again, normally this would be a Brandon job if we had both arms.
Kids'
But we're gonna just slice it nice and thinly.
La la.
It smells so good. I wish we had smell vision so you could smell this fresh mint. All right, do you want to, actually let's toss the berries together first.
Okay, can I do it?
Yep, go right ahead. Let me help with that.
I want to.
Good, underneath them.
Can I use this one?
Yep.
You use one, I'll use one.
Okay, try tossing them all together. We don't want to crush the berries, we just want to kind of toss them together. There you go, good job. All right, that's fine. And now you can sprinkle the mint on top. Beautiful.
And our little cherry on top.
And there we have it. There is our lemon mint berry fruit salad.
Yahoo!
For our second EOE recipe, we are doing one of my absolute favorite recipes that was inspired by this little guy, Leo. Say hi, Leo.
Hi.
How old are you?
8.
Do you love cooking like your brother does?
Yeah.
So Leo is my little kitchen helper, and Leo was actually diagnosed with a dairy allergy and a soy allergy when he was a little baby. And so he's always been dairy and soy free, and this recipe actually came out of him being obsessed with hummus. So Leo has always loved hummus, and he will eat store-bought hummus, but he much prefers when mom makes homemade hummus, Well, I found myself one day with Leo begging for hummus, having no packaged hummus in the fridge, and no garbanzo beans. And so this was oh my goodness, what's mom gonna do? My kid is hungry, wants hummus, and gotta make something. So here came our white bean and sweet potato hummus, because I had sweet potatoes in the house and I also had a can of cannellini beans. And so thus this sweet potato white bean hummus was born out of Leo wanting hummus for a snack. So we're gonna make it for you today. This is an absolutely simple recipe that you can take to any holiday party and everybody will be blown away by how good it tastes. So it's super simple. Leo is gonna start by adding our cannellini beans into the food processor. We also already went ahead and roasted this sweet potato. You can do this a couple of different ways. I roasted it today. I put the oven at 400 degrees and roasted it for about a half an hour until it was super soft, and now it's cooled so I can peel it. You could also do this in the microwave. If you're gonna do this in the microwave, you're gonna take your potato, you're gonna pierce it with a fork all over, put it in the microwave for about 5 minutes, and then check it. Sometimes, depending on the potato, it will be soft enough. If not, keep doing it for 1 minute increments until it's soft enough that you can pierce it all the way through with a fork. Then be sure to let it cool all the way. If you try and peel it when it's too hot, you'll burn your fingers as that steam escapes from the potatoes. So make sure it's cool. So we're just gonna pull all this off. While I'm doing this, Leo, do you wanna go ahead and put the garlic clove into the food processor?
Yes.
Yep, the garlic clove. Good job. Now we have this other minced up item here. This is ginger root. So ginger root gives such great flavor to hummuses and lots of different dishes. So I went ahead and I minced up about a teaspoon. Could you go ahead and add that one in for me as well? Thank you, Leo. All right, we almost have this potato fully unwrapped. All right, so the potato has the skin off. I'm just gonna cut it into a couple of pieces so that when we puree it, it's not just one big clump. We can go ahead and put those in. Okay, you go ahead and do that. And now we have a lemon. So the lemon is whole right now because we're gonna zest the lemon so we get all of that wonderful lemon flavor that comes with the zest. So Mama's gonna go ahead and do the zesting. Can you smell the lemon? It smells good, doesn't it? Mm-hmm. So this just gives it added flavor. We're also gonna put in the lemon juice. All right, there's the zest. Okay, we're gonna slice this lemon in half that we already zested. And Leo, you wanna help me squeeze out the lemon juice?
Yeah.
Okay, go ahead and put it in. Yep, that way is right. Let's squeeze it down together. Good job. Now we'll dump it to make sure we got all the lemon out. Sure. This is a kid's like dream job. It's like using all of their strong and mighty muscles to get every last drop of lemon juice. Good job. All right, and you know what? There's still another half to do. All right. Yep, you got it. There you go. Good job. All right. And finally, olive oil. Oh, I'm sorry, this is not olive oil. This is actually avocado oil. But you could use olive oil, avocado oil, whatever you happen to have on hand. We're using avocado today. And Leo, this is our beautiful basil plant, right? Leo and I have been growing basil for quite some time, and this is our beautiful plant that we keep in our kitchen window. So we're gonna go ahead and take off some leaves you can put in. We're gonna take about 6 leaves to put into our hummus. They smell so delicious. Smells good?
Yeah.
All right, and that's it. We're gonna take the top. All right, go ahead and hit the on button. Everything is a little thick, but we want this consistency. We don't want to thin it out too much because when it's done, you want it to be a very thick hummus. All right, so it's very thick, which is exactly what we want. We're just gonna scrape down the sides one time. There's still one little piece of potato in here we want to get blended up. There we go. You can turn it on. Go ahead. All right, so we're gonna take our hummus now and we're going to put it into our serving dish. You can try it. You can talk.
Oh, I can.
Yeah. Does it smell good?
It smells amazing.
All right. There we go. And now we've decided to serve it today with some cucumbers and some gluten-free crackers, as well as some carrot sticks. You want to go ahead and give it a try?
Yeah.
What do you want to try it with?
Amazing.
We hope you enjoyed these recipes today and that you'll take them to your family gathering this holiday season too.
Well, thank you. Thank you everyone for this amazing and comprehensive presentation. Thank you, Erin. Thank you, Crystal and Vanessa. And now we're going to start our Q&A part of the last piece of the webinar. I'm going to ask the audience to submit their questions. But as we have in here some questions, I'm going to start with Erin. Dr. Simerson, how you decide what foods to eliminate from someone's diet, and how you decided what to add back and when?
Great question. So a lot of these kind of questions that we'll get, they tend to be very much family specific. I try really hard to have shared decision making with families when it comes to making these decisions, because there might be other factors like we talked about a little bit earlier that might limit the foods that we can eliminate from the diet. I think it's really important to keep in mind whether kids also have IgE mediated or immediate allergies that are already limiting their diet at baseline. What is a kid's diet like to start? And then we kind of go from there and decide what families like to do. I think in the absence of any other kind of factors like that, which is actually pretty rare, we know that there's the most success with dairy elimination. That's kind of your top most common trigger for EOE, just in general. But so that tends to be where I start if there's a family who would like to start with dietary elimination. I usually suggest dairy as our best first option, provided there's no other limiting factors.
Wonderful. Crystal, you talk a lot about cross-contamination as well. Very nice exposing that. There is an interesting question that is eliminating dairy is the same as lactose-free. Do you like to comment on that?
Yeah, that's a good question that comes up a lot. So, unfortunately, lactose-free is not the same as eliminating the milk and dairy. It's really about the protein. And so I do have to remind parents that it's not the same. Like, unfortunately, we're not just removing lactose, which is a sugar. We're actually removing milk entirely, and milk proteins as well. So that's like any form of milk, including baked milk.
Wonderful. As this webinar is going to be seen by our families, this is a very important point, right? Vanessa, I would like you to comment on how to start the process of converting a favorite recipe to meet a child's unique dietary needs. How you do that?
Yeah, so there's typically a few things that in a recipe. So one of the most common ones people ask about are things like a Toll House cookie recipe or a birthday cake recipe. And so the things that you're probably going to look to replace are the milk or the dairy in it, the flour, or a fat like butter or oil. And so for something like milk, you could use alternatives like soy milk, almond milk, coconut, or oat milk are just a few examples of a dairy that you could use. And if you need sour cream or cottage cheese in these types of recipes, they also make dairy-free versions of almost all of them in most grocery stores today. For flours, if you're needing to be gluten-free, there are dozens and dozens of gluten-free all-purpose flours, but there's also individual flours like brown rice or sorghum, coconut, or almond flour. And then for the butter, which can often be a bit more challenging to replace because you don't get the same consistency, but there are some pretty good dairy-free butters now in stores. My favorite ones are the ones that are made from avocado oil. You can also get ones that are made from soy or olive oil and canola oil. Another one of my favorite things to replace butter with is avocados. If the light colored recipe, you'll notice that it turns green, but if you're making something like a chocolate cake, you won't even notice that you've put avocado in place. And actually, a secret ingredient of lots of gluten-free donut recipes is actually using avocado as the fat in them. So it's actually a really good one to try.
Very nice. So this comes a lot from our patients asking, Ari, I'm gonna start with you. How strict you needed to be with an elimination diet? It's okay cheating days? I mean, we ask a lot, patients ask a lot this question.
Yeah, it's a hard question to answer because this is where we just don't have good data. When it comes to like a true cheat versus, right, like something that's purposeful and planned versus like an accidental thing, they're two different things to think about. Dietary elimination is hard. Even just one food group, just picking, say, dairy, that's really hard, especially hard for kids. So, I mean, you have to give yourself some grace, right? If you have an accidental exposure or ingestion, I mean, you can just try your best. The less kind of accidents or like accidental exposures we have, the better we know that we do, just from experience. I think when things can be a little bit tricky is when families will ask about, well, what about their birthday party, right? And they want to have something that has, say, I keep using dairy as an example, but replace it with whatever the food is that we're eliminating. Special occasions, like, is that something we can allow? I think we don't know officially, but the less we can do it, the better. But we all know that we're human. So I mean, just to be honest with families, I tell them, like, listen, if that's what you want to do, that is totally fine. Let's make sure we don't do a scope the next day, right? Let's not make sure we have a scope planned where we then are not going to know how to kind of determine what we're seeing on there and make like decisions on our next steps in management. So I think just being thoughtful about how we do it and then just being honest. I always try to remind families, like, listen, this is like, no one's going to get in trouble. We all just need to be honest because we all want what's best for the patient or the child in this case. But we have to be realistic and give ourselves a little bit of grace. So
Wonderful. So, Crystal, do you use some apps? Can you tell us if there is some tools that could help patients with meal planning and elimination diet?
Yeah, there's a lot of cookbooks out there. I think if we keep out the mindset of making sure we're looking at allergy free, that usually should cover the bases. So, like we've all been talking about, we don't necessarily have to recommend eliminating all of the allergens all at once at the same time. There's different ways that we can do that. But if, let's say, somebody is doing that, like straight off the bat, going straight to 6 food elimination, then yes, allergy-free cookbooks will be the most helpful in that case. There are apps also for looking at ingredients. So I think 2 of the more popular ones out there are Spoonful and Fig, which I both come with like a scanner, so you can scan the barcode. And they've been very thoughtfully designed, I think, for this purpose. And then there's always, the other, just like searching at what other parents have done. There's a lot of blogs I know that have recipes, and if you're ever unsure, I always tell families, like, if you're ever unsure, you're looking at a recipe and you think it looks great, and you want to just double check, it's never a bad idea to run it by the dietitian and the doctor just to get, second, third look, to make sure that it is actually what we think it is and that it is okay to use these for menu planning. But I think it's always a team approach and just kind of working off of what the kids like as well.
Sure. So, Vanessa, how we make sure kids get like doesn't get like boring foods, right? They get something excited with this elimination diet. How you do your magical chef touch?
So as hard as it can be, I think the answer here is always to plan ahead, that things get really boring when you're just always doing the same thing over and over again because it's the easy thing to do. And while I know that it can be hard to carve out that time on a Sunday night and, plan ahead and make things ahead of time, it's really the best way that I can keep things interesting in my household. As you saw in the video, we have 2 dietary restrictions in our household. And so I'm always thinking about that. I'm always thinking about food that's going to make everybody be healthy, but also that's going to be interesting to my husband who can eat everything. And so I plan ahead. So for example, it's freezing this week in Boston. And so I made butternut squash soup, which was absolutely delicious. And I made extra of it because I knew that I could take that leftover soup tonight and make pasta sauce out of it. And so all I did was heat it up on the stove, mix it with some Parmesan cheese, and then I tossed in cauliflower gnocchi. And so, two different dishes that I was able to season a little bit differently to keep it interesting, but I still only had to make one batch of the main ingredient for it. And so, just thinking ahead of how you can stretch things, batch cook, turn them into unique and interesting things can really help you, not get bored in the kitchen.
Mm-hmm. Super. So, Erin, you are talking about that the skin test is not really useful for us as a pediatric gastroenterologist. So, the question is kind of how we incorporate the allergist into this multidisciplinary clinic and approach for EOE.
Yeah, that's been an evolving thing over the past decade or two, right? As I mentioned, I think initially we were hopeful that skin prick testing and blood testing for allergies could kind of give us a little bit of a guide for what foods to eliminate, but it just hasn't panned out that way so much. But that being said, I still work really closely with my allergy colleagues. We know that EOE is an allergic condition, and allergic conditions like to hang out together, right? So many kids, as I think everyone is aware, many kids with EOE, some have IgE mediated or immediate food allergies, some have seasonal allergies or environmental allergies, some have asthma, some have eczema, all things where our allergy colleagues are quite savvy and very helpful. And we do know that that EOE is better controlled when the other allergic conditions are controlled. So kind of when kids are fully optimized from an allergy perspective. So having a multidisciplinary clinic where I can go back and talk to my allergy colleague who's seeing the same kid and getting their insight as how do we make sure that they're kind of optimized from all aspects is really useful. And allergists are also trained for EOE management too, though they're not generally the ones doing the upper endoscopies. So it's just really nice to have people to bounce things off of who then we can get to know the patient from all aspects. And I learn a ton from them too. So it's really just this allergy umbrella that we try to manage as best we can.
Absolutely. Very important. The more the merrier, right? When we are discussing those cases. This question, actually, I want to see Vanessa as a chef and Crystal as an RD, how we would see a picky eater here. So what do you do if a child is a picky eater and now you have to do this elimination diet? What do you guys do?
Sure, I can start. So I have like three things that I like to do. So first of all, as painful as it can be to take a child into the grocery store with you, I really think it's one of the best things that you can do is let your kids go and just be in the presence of food. So when my kids were really little, I used to take them, and the rule was that they could pick one thing from each aisle of the grocery store with the understanding that they had to at least try it. It was okay if they didn't like it, but they had to at least try it. And it became like a really fun game for them to run through the aisles, and they'd each have their own little section in the cart where they would put their picks. And they did always try it. And I feel really blessed that my kids are really good eaters. And I'd like to think that part of it is, that I was exposing them to food early, and it continued to encourage them to try new things. The second tip I have is to have a garden or a community garden where your kids can plant things and watch it grow. They're not always going to like every single thing that they pick off the vine, but for them to pick a fresh cucumber or to pick the sweet cherry tomatoes off the vine are like really wonderful ways to get your kids eating fresh fruits and vegetables and feel really accomplished that they have, grown them from the seed all the way through to getting to eat them. And the last thing that's one of my favorite things is to go to a bookstore. I know we tend to order books online these days, but go to an old-fashioned bookstore and just sit your kids in the cookbook aisle and let them pick cookbooks. Let them flip through the pages, pick one to buy, and then commit to cooking a recipe with them. It doesn't have to be every night or even every week, but inspire them to look at the pictures. You eat with your eyes first, and find food that inspires them so that hopefully they'll be willing to try it.
Very good, very good. Crystal, you want to give us some tips about that?
But yeah, I think she covered most of them. I think the only other thoughts, so I do all those things. I always recommend those things as well. I think getting the kids involved is very, very important. Giving them a voice, I think. And so letting them know and building that trust that they don't, have to like everything that they try, or everything that gets brought up. They're not being forced to eat it. But we would like to foster more imagination, more open-mindedness. And so the only other thought I would want to add is I usually have parents, especially when we're doing an elimination diet and we're picky, working off of what the kids already like and okay, picking it apart, what can we find that's similar and substitution? How can we branch out from there? But again, I think building that trust and just imagination and open-mindedness to explore, plant things, grow things. I think that really helps in the long run, just so that kids know their voice matters too. It's we want them to be part of the team.
Absolutely. Involving kids is very important. So I think we are in the top of the hour. We had a very, very nice discussion. With that, I would like to wrap up and thank NASPGHAN and NASPGHAN Foundation for hosting this webinar. In addition, a special thank to Kate Farms, who supported this webinar through an educational grant. Please make a note of the next scheduled webinars in the series is going to be actually milk protein allergy and lactose intolerance on February 26, and Crohn's disease on March 19. Also, all past webinars are available on-demand programs on the NASPGHAN Learning Online site. Thank you, Dr. Erin Silverstein, our registered dietitian, Kristen Tesai, and the medical chef, Vanessa Weisbrod, for their excellent presentation and this discussion this evening. To our audience, thank you for participating. And please follow the link in the bottom of the player window titled "Click here to return to the NASPGHAN Learning Center" in order to complete the evaluation so we can get your feedback in developing additional educational opportunities. Thank you, everyone, and have a wonderful evening.